Hello, this is Jim Hook, Director of Consulting Services for the Fox Group. In the next several minutes, you'll have a chance to learn how to make vendor demonstrations of EHR systems meaningful and useful. Vendors usually go through the functions of their system by reviewing the menus and icons available on the screen. But that can leave you wondering how it all fits together to support the flow of patients through your office. One way to avoid these problems is to have a specific list of functions you want to see demonstrated, and to have them demonstrated in a particular order. You also want to see activities that are sequential actually demonstrated to come up that way. For instance, a patient who is marked as having arrived and is ready for rooming should appear as checked in on the screen for the medical assistant who will room the patient. There are at least 8 specific areas that a vendor should cover in a demonstration. Most systems have a type of physician Inbasket, which shows the patient schedule for the day, lab and other test results awaiting review, prescription refill requests, and patient messages, just to name a few. It may also show unfinished progress notes, internal messages, and other system components important to providers. The medical assistant Inbasket shows the daily patient schedule and all the follow-up tasks assigned to the medical assistant, such as processing referrals, sending patients for lab or x-rays, handing out patient education materials, or documentation of activities such as making follow-up calls to check on the progress of patients who have previously been sent for testing or other specialty care. Patient scheduling functions typically include making appointments for new and existing patients, entering and noting patient alerts related to clinical or administrative issues, waitlist functionality, eligibility verification, and authorization tracking. Patient check-in functions usually include capturing demographic and insurance information, patient tracking within the office, collection of co-payments, and issuing receipts for payments. Encounter documentation is one of the central elements of a system, affecting the workflows for the medical assistant and the physician. This should include demonstrating compilation of the visit note or a report by a specialist to a referring physician, orders for testing, referrals, and medications, CPT and diagnosis coding support, and authentication of the final note and transmission to billing. Patient checkout includes patient education materials, follow-up instructions, and return appointments, plus patient collections if payments are not collected upon check-in. Billing and collections is another extensive part of an integrated application. The vendor should demonstrate how claims are developed, submitted, and scrubbed. The communication with clearinghouses, automated payment posting and account adjustments, insurance and patient AR follow-up are all additional functions that need to be demonstrated. The vendor should also demonstrate how easy or hard it is to move between applications such as EHR and billing, especially if the system uses different databases for each application. Each system has other functions, including reporting capabilities, patient portals, and mobile devices for hospital rounds. You also need to see the audit trail function, the controls for user privileges, and system security. An effective demonstration is an important part of due diligence in deciding if a system meets your needs, and is your opportunity to ask questions of the vendor that you need answered. Watching several demonstrations can take time, but it will help you make a good decision when the time comes. If you'd like to learn more about how to introduce an EHR system into your practice, or about the Fox Group in general, give us a call, drop us an email, or come visit us on the web, where you'll find several other short videos on the subject. The Fox Group, providing excellence to the healthcare community since 1989.